Welcome back to another session of Understanding Human Anatomy. And in this video, I propose to talk about the innervation and vascular supply to the trunk. Now basically I'm talking about the thorax and abdomen. We're not talking about either the upper or lower limb, nor of the head and neck. Those areas are much more complicated, and to understand their innervation and vascular supply, you first have to understand the vascular supply of the body wall. And this nerve and vascular supply resembles that of a segmented animal, like an earthworm, that the body develops as a number of segments in the torso. And each segment has a nerve and a blood vessel, a nerve and an artery supplying it. And what we're going to do is follow that pathway in a diagram. Now I've started by putting a spinal cord, dorsal root ganglion, ventral root, and spinal nerve on each side. The dorsal root, ventral root, dorsal root ganglion, spinal nerve over on this side. In black, I've sketched in parts of the vertebra, the body, the pedicles, the lamina, the processes. But notice that there's a big gap between the lamina and the pedicles. What I've done is made this a section through the intervertebral foramen, so we can see the spinal nerve exiting through the intervertebral foramen. Now, the spinal nerve exits the intervertebral foramen, and it gives off a branch. It basically divides into two: an anterior ramus and a posterior ramus. Let's talk about the posterior ramus first. Let me get some labels in here. The posterior ramus and then the anterior ramus. And we'll get the line here pointing to the anterior ramus. Now the anterior ramus will wrap around the body wall. As I'm trying to show here. Like so. And the anterior ramus will actually be running in between layers of muscle. The inner layer muscle and an outer layer muscle. The posterior ramus passes in between the postvertebral muscles. So I'll draw a couple of generic postvertebral muscles in here. And the posterior ramus passes between these layers of muscle and then emerges through the muscle as a posterior cutaneous nerve. And when that nerve gets to the skin, it branches into two, sending one branch medially and one branch laterally. So this nerve that is emerging through the postvertebral muscles is the posterior cutaneous. And commonly we use the abbreviation N for nerve. Posterior cutaneous nerve. Now, there are a number of these nerves that come through the muscle periodically along the back, and when one is dissecting the back and removing the skin, you will see these nerves poking through. They are providing primarily sensory innervation to the skin. Cutaneous is a term that means skin. So the posterior ramus branches from the spinal nerve and then passes through the postvertebral muscles, providing innervation to those muscles, and then whatever axons are left continue on as the posterior cutaneous nerve to supply the skin. Now, the anterior ramus, as it wraps around the body wall, when it gets about halfway around the body wall, on the lateral edge of the body wall, it gives off a branch. That branch is the lateral cutaneous nerve. Again, many of them, one for each spinal nerve. And when that nerve gets to the skin, it sends a branch posteriorly and another branch anteriorly. So, the lateral cutaneous nerve, and the lateral cutaneous nerve is going to supply the skin on the lateral aspect of the body wall. By sending the branch posteriorly, it goes back essentially to meet the branch coming around from the posterior cutaneous nerve, and that sends one anteriorly as well. The anterior ramus continues around between the layers of muscle that gets not quite to the midline, a little bit lateral to the midline, and it gives off a branch that pierces the muscles and comes out to the skin on the anterior surface. And when this nerve gets to the skin, it sends a branch laterally and a branch medially. This nerve is the anterior cutaneous nerve. the anterior cutaneous nerve, and the anterior cutaneous nerve is supplying the skin on the anterior surface of the body wall. So we have posterior ramus supplying postvertebral muscles, anterior ramus running around the body wall, and these muscles would be the prevertebral muscles. It would be supplying them. We have cutaneous branches from the posterior ramus, the posterior cutaneal nerve, and from the anterior ramus, the lateral and anterior cutaneous nerves. So with this basic plan, in one segment of the body, we've supplied all the muscles and the skin with innervation. Motor innervation to the muscles and sensory innervation to the skin. Now, if we duplicate this on the other side, we'll have supplied the entire segment all the way around the body. So give me a minute and I'll sketch in the other side. The anterior ramus wrapping around the body wall. The posterior ramus going around to the back, giving off the posterior cutaneous nerve, which branches laterally and medially. The lateral cutaneous nerve going out to the skin, branch posteriorly and a branch anteriorly. And the anterior cutaneous nerve, which gets to the surface and branches laterally and medially. Put in some of the muscles here. There's the postvertebral muscles. And then the outer layer of muscle on the body wall. And then the inner layer of muscle. So, with that, we have the entire segment of the body supplied with sensory and motor innervation. Now, the only place where I've really fudged on this diagram is I've made it look like it would appear in a cross section. Remember when I talked about the rib, I said that the rib descends as it wraps around the body. In other words, the rib doesn't go straight around horizontally, but goes at an oblique angle so that the distal end of the rib lies at a lower level, an inferior level, to the proximal part of the rib. Well, the ribs in the thorax identify segments. The segment is the area between the ribs. So if the ribs descend, then the segment does also. And if you look in a textbook or an online resource, you'll see pictures of the dermatomes. And if you follow them, you'll see that the dermatomes parallel the ribs in the thorax and keep the same general orientation down in the abdomen. There are no ribs to follow, but the course is the same. So I've made this look as if it was horizontal, the segment was horizontal, when actually it is a little bit oblique, with the anterior end being slightly inferior to the posterior end. Now, next, I want to sketch in the vascular supply. Okay, now that I've magically cleaned the labels off of the diagram, I want to put in the arterial supply. Now I'm going to concentrate on the arterial supply. The venous supply will be similar. We'll get to the details of the venous drainage of the body wall as we move further along and study the thoracic and abdominal cavities. For now, it's safe to assume that there's a vein accompanying the artery. So, let's start by drawing an aorta in. And the aorta is a midline structure, so it sits right in front of the body of the vertebra, right in front of the vertebral canal. So this is the aorta. And the aorta is the main artery taking blood from the heart and distributing it out to the tissues, to the body in general. Now, opening off the back or posterior side of the aorta are segmental arteries, and I'll draw one in here. You see it follows along, and it runs over and joins with the anterior ramus in that same space between muscle layers, and follows around just like the nerve. And it will give off lateral and posterior branches just like the nerve. Now these arteries come in pairs, so I'll draw the other one coming off on the other side and gaining this space between muscle layers and running with the nerve around like so. Giving off lateral, posterior, and anterior branches. So this basic supply of segmental arteries provides the segment of the body wall with an arterial supply. And as I said, there'd be a vein accompanying these arteries. So we have arterial supply to the muscles of the body wall, the postvertebral and the prevertebral muscles, and going out to the skin. So we've supplied the entire segment with nerve and vascular supply. In summary, the spinal nerve exits the vertebral canal through the intervertebral foramen. It gives off a branch posteriorly called the posterior ramus, which supplies posterior or postvertebral muscles, and then continues as posterior cutaneous nerve, reaching the skin and supplying the skin on the posterior side of the body. The remainder of the spinal nerve is called the anterior ramus. The anterior ramus wraps around all the way to the anterior side of the body, giving off lateral and anterior cutaneous nerves, which then go to supply the skin on the lateral and anterior sides of the body, respectively. The aorta has segmental arteries branching from its posterior wall, and these arteries run over to the area of the anterior ramus, where they enter the same intermuscular space and run with the anterior ramus of the spinal nerve. These segmental arteries give off posterior, lateral, and anterior branches so that the muscles of the wall and the skin are all supplied with blood. And this is the basic plan of nerve and vascular supply to the trunk. Thank you for your attention.